So the 4Ps are just a way of thinking about innovation, and they talk about product, process, position and paradigm. And what that means is product is fairly easy, you know what they would be. They're the kind of things that you buy in a shop and use. Service, you'll know. It's a kind of thing where you're accessing a service, whether it's health service or those kind of things. Position is a bit different. Position is about saying that we already might have this kind of product or service, but actually it's about how we think about that product and service. So an example is community managed acute malnutrition, where that used to be positioned as something that was done within kind of a field hospital or somewhere like that, and now it's something that's done at home. In a social setting, not a medical setting. So that's a real difference in position on how we think about that. Paradigm are the things that you may have Uber where you are, or you may have other things where we completely change the way we think about a whole way we do things. And so an interesting example, I think maybe Ushahidi or something like that, where actually we're saying we don't just go out and collect data, but actually we ask people to send us their information, their data about what their needs are and what their context is like. So innovation is really about thinking differently and creatively to create new kind of solutions. And so it's clear that humanitarian needs in many places are outstripping our ability to meet those needs with regulatory and disasters and the impact of those. So what we're hoping with innovation and what can be done is actually finding new ways to deliver more efficiently, more effectively, being able to respond better. And so really that's what innovation can do for us. What the sector is really good at is innovating around maybe sector standards and those kind of things, and disseminating them. People use them. So if you think of sphere standards, they're kind of things that have happened that we might not think of as innovations, but they are. The one that's often pointed to that's gone really large is the use of cash. And so instead of giving non-food items and other things, actually having cash, so that people who've been affected by a disaster can actually go and purchase the products and services that they need. So for an organization to deliver, it's sometimes not just the kind of product or the service or even the process that they're doing. It can be actually how the whole organization functions, or a part of how the organization functions. So that's called kind of business model innovation. And that really can look at how you do your activities, who you partner with, where you get your revenue from, how you engage with affected communities or with your donors, those kind of things. So really thinking innovatively and how you might do that differently to increase your impact.